Hello, and welcome to another edition of the Kayal Ortho podcast. Today is Tuesday, May 30th, 2023, and I'm so happy to have with us today our very own Dr. Mark Leichter, a chiropractic physician at the Kayal Orthopaedic Center. Welcome to the podcast, Dr. Leichter. So happy to have you.
Thank you, Dr. Kayal, for having me.
Let's start and just jump right in, and let's talk about the field of chiropractic. Can you just define for our community of listeners today, Mark, what is a chiropractor?
Great. Thank you, Dr. Kayal. So chiropractic is a form of alternative and complementary medicine. It's been around for over 100 years, and it affects the joints of the spine, as well as some chiropractors also perform work on the non-spinal components. And one of the main conditions is called a subluxation. And a subluxation is very easy when the articulation of the joint is not fully aligned, it's very minutely off. The chiropractor will go in there and perform what's called a spinal adjustment.
Now, what about the history of chiropractic?
So the history goes back to 1895 when Daniel David Palmer decided to treat his first patient. He brought the patient over to his house and he had a chiropractic table, which we call today. Back then it was just called a table. And he performed a spinal adjustment on that patient who had multiple conditions, and the patient was relieved almost immediately. Dr. Palmer thought it was a great thing that he invented, and 2 years later decided to open up the first chiropractic school in the Midwest. And from there, scattered throughout the country, we have numerous chiropractic schools. 2 years later, his son got into it as well, and his name was B.J. Palmer as well.
And I guess over the years, your field has integrated and incorporated other aspects of complementary and alternative medicine, such as, therapy and exercise and nutrition and things like that, right, to supplement the field.
Yeah, so we have numerous other forms of healing, and we do nutrition, as you mentioned, and some states allow it. And then we also do modalities and procedures. Some of those modalities are interesting. They go from electrical muscle stim to ultrasound. And then we do procedures also, which are hands-on exercise, stretching and strengthening, and different forms to enhance the spinal adjustment and help the patient achieve maximum benefits.
Do you find it odd that I, being an orthopedic surgeon, are interviewing you, a chiropractic physician, or even that you're a part of the Kayal Orthopaedic Center? Is that strange to you?
Knowing how you are for the past 10 years, it's not strange. You're one of a few orthopedic surgeons that actually appreciate chiropractors and what they do. So it's not strange to me. I'm honored to be here. And this is just a great experience, everything we've done in the past 10 years to bring chiropractic into the main front, and how you cherish and honor all chiropractors and are bringing them into the practice.
Yeah, I remember when I started out 25 years ago, a lot of my patients would question me because I've always believed in the field of chiropractic medicine. It's interesting. I'm an orthopedic surgeon by trade. I'm a surgeon, but most of what we do is non-operative. You know, the beauty of the field of orthopedic surgery is that we are really the primary care physicians for the musculoskeletal system. Patients often see us first for their shoulder pain, their hip pain, their knee pain, their foot and ankle pain, their back pain. Most patients don't end up calling their internal medicine physician when they're suffering from a musculoskeletal disorder. I'll be the first phone call, and they'll want to be seen. And most of what we do will turn out to be non-operative. Most of the ailments of the musculoskeletal system involving the shoulder, hip, knee, foot, ankle, you name it, can often be treated non-operatively. Often we'll get patients into physical therapy, massage therapy, acupuncture, chiropractic, and often, just treat them with some rest, activity modification, anti-inflammatories, and possibly even trigger point injections or interventional pain management. And these patients never end up requiring surgery. And that's the beauty of the field of orthopedics. We treat patients non-operatively. We see them for every ailment involving the musculoskeletal system. And ultimately, if they do need surgery, we do that as well. But that is why at the Kayal Orthopaedic Center, I've always believed in a team of physicians that would collaborate with one another and bring their expertise to the patient to help that patient get better, however possible. I never really cared whether it was the anti-inflammatory or the rest or the physical therapy or the injection or the chiropractic care or the massage care or the acupuncture that made the patient better. We treat patients as a team. We collaborate with one another, and we work in earnest, and we address that patient's disorder from multiple different angles. And as a team of healthcare providers that's adding their expertise to the care of that patient, it's the whole recipe of teamwork that basically helps that patient get better. And that's why I've always believed in the field of chiropractic care, because they do complement our services as orthopedic surgeons and very often help our patients get better faster and allow us to treat our patients often non-operatively. So that's why we're so happy to have you, Dr. Leichter, with us. Dr. Leichter and his Stony Point chiropractic practice was actually the first practice that joined us, and we've been working together for over 10 years now in northern New Jersey and New York as well. So thank you for that, Dr. Leichter. Knowing that there is some controversy out there where the allopathic community of, say, orthopedic surgeons and medicine physicians in general sometimes poo-poo the field of chiropractic. I don't know if it's because of, fear of losing patients to the other specialty. Knowing that, have there been some legal battles over the years that have ensued since D.D. Palmer in the late 19th century developed the field of chiropractic medicine?
Yeah, actually, back in 1895, X-rays, were just not even a part of the practice, and then became integrated into practices. And places like even New York weren't even, a chiropractor was not even allowed to perform X-rays, and would actually go to jail if they performed the X-rays. And now we're over 100 years later, and therapies, procedures, modalities, everything we talked about, the X-rays, these are all complementary alternative parts of chiropractic that are now allowed and accepted in the practice. But back years ago in the 50s and 40s and 50s and 60s, chiropractors did go to jail for taking X-rays, and we are now permitted to do X-rays. We have X-rays in our practice, and we are allowed to send out for advanced imaging as well to further enhance and understand the patient as a whole.
Yeah, I guess the physicians could only fight it for so long. It was a well-received and respected field. The patients certainly embraced it, and the onus was on us to embrace it as well and accept it as a complementary alternative field of medicine that can help our patients get better. And fortunately, for me and my business, it was something I recognized 25 years ago, and I embraced the field of chiropractic even back then. I have so many friends that are chiropractors in the northern New Jersey and New York community that I've worked with for over 20 years and have enjoyed fantastic relationships with. You just happen to be one of the first. But as a team, we've collectively cared for so many patients non-operatively and held their hands through their pain and their orthopedic conditions, and we're fortunate enough to see thousands and thousands of patients get better. You have to answer a question for me if you don't mind,
Yeah.
Dr. Leichter. Do chiropractors actually crack your back?
That is the number one question when a patient walks in the door. No matter what office, who you are, every patient will say, "You're a chiropractor, you crack backs, you crack joints." No, that is obviously a misnomer. And what we actually do is by performing a spinal adjustment, it's actually the gas releasing from the joint is the actual noise that the patient's hearing. But each patient will always call, "I need a crack doc, I am coming in." So that cracking noise is a misnomer, but we do release the gas out of the joint, and that's the audible noise that a patient would hear.
My wife always reminds me whenever we end up talking about a chiropractor, she repeats the joke or the story probably for the 10,000th time since we've been married, that her dad was a very, very avid, believer and in the field of chiropractic, and would always go see his chiropractor, and kept wearing this T-shirt that said, "My chiropractor cracks me up.
And that's exactly what we get all the time. So I'm glad to hear your wife was a chiropractic fan growing up.
But she actually keeps cracking up over that joke, over and over and over again. My chiropractor cracks me up. Isn't that funny?
That's great.
Yeah, but it is something that, as an orthopedist, whenever I do refer patients to chiropractors, sometimes there's a sense of apprehension, but it's sort of a misunderstanding. It's a myth that that's what chiropractors do. It's really just subtle musculoskeletal adjustments that are being performed where joints are what we call subluxed. It's not a frank dislocation of a joint where a joint is out of its socket completely, but there are different types of joints in our bodies. There are ball and socket joints, there are pivot joints, there are hinge joints, and sometimes these joints are what we call articulations. For instance, a knee, this would be a hinge joint of a knee, where the bones are articulating with one another. A ball and socket joint of the shoulder would be something more like this, where the ball is articulating in a socket. A ball and socket joint, for instance, would be, a shoulder joint or a hip joint. A hinge joint might be a knee joint, for instance, that's hinging. But those joints should be stable, they should articulate with one another, and they should stay well aligned. And I guess the field of chiropractic was developed when these joints were found to sometimes sublux or slip a little bit out of the normal geometric articulation of that joint. And when they would sublux, it could cause local pain in the joint. It could result in a sense of instability to that joint. And certainly, if those joints were to involve the spine, there would be some compression potentially on some nerves, which can then radiate and cause pain in the extremities. So is it true, Dr. Leichter, that sometimes patients are seen by chiropractors for not only ailments that are stemming from the spine, the neck, the upper back, and the lower back, but also the extremities, the shoulder, the elbow, the wrist and hand, the hip and knee, foot and ankle? Do some chiropractors treat the whole body, whereas others might just focus on the neck and upper back and lower back, and others will focus only on the extremities? Can you elaborate on that at all for us?
Yeah, as I said, there was multiple schools after D.D. Palmer started his, and some schools teach just treating the spine, and then they got into treating non-spinal conditions, as you said, for the specific joint, this specific movement in the extremities also. So there are numerous chiropractors that treat the shoulders, the knees, the elbows. Different joints are everywhere, and chiropractors will treat those. And then, as I said, spinal, the cervical, thoracic, and lumbar, these are parts of the back, and these are well known to get adjusted by a chiropractor and relieve the pressure, as you said, with that subluxation, which is a very, very small misalignment.
That's great to know. Thank you for that. It sounds like what you do is fairly similar to physical therapy and what physical therapists do, but there has to be a difference. Otherwise, these two professions would not exist. Can you sort of explain for our community of listeners how chiropractic care is different than physical therapy care and treatment, and how you often do on a daily basis collaborate with those physical therapists and take care of the patients often at the same time, and why there's a need to do that?
So I'd rather say that the two fields actually complement each other. And what I mean by that is physical therapists are known to specialize in the movement of the body, movement of the extremities, movement in general. Chiropractors will do that spinal adjustment, which will be for a biomechanical little change of that subluxation. And by doing the two, I think they enhance each other. A patient may get an adjustment first and then move over to physical therapy to stretch and strengthen the area that was just adjusted and further enhance what they're doing and to stabilize and give them much better outcomes.
It sounds like you work with physical therapists on a daily basis, hand in hand. and you complement one another. How does a guy like me come into the picture? How do you end up working with the orthopedic surgeons, the team of orthopedic surgeons that you work with on a daily basis?
So numerous patients have a plethora of conditions, unfortunately, but it's true. So these patients come into us, and sometimes, they may not be a strict physical therapy patient or a chiropractic patient. By sending them over to your team, the Kayal Orthopaedic team, which we have numerous providers that specialize in different things, the orthopedic will help evaluate the patient, educate the patient, and treat the patient if there might be an underlying condition going on. So we work as a team to enhance the patient's well-being. And it's an overall team approach, which is an amazing process. As you said, it's just not about chiropractic and physical therapy. It's about the orthopedic team. It's about pain management. It's about acupuncture. There's many forms of treatment that assist and help the patient.
Yeah, so one of the things that's beautiful about incorporating chiropractic into the Kayal Orthopaedic Center is something that I've implemented in the practice across the board. And what that is I've insisted that all patients being seen by a chiropractor or even a physical therapist also get seen by an orthopedic surgeon. It's important to me to never miss anything in our practice. So, there is a concern in the community out there that chiropractors potentially sometimes can hold on to their patients for a long period of time, for months or years, and see them over and over and over and over again. And there's nothing wrong with that if they're maintaining a medical condition or if they're keeping symptoms at bay for a chronic condition. There's nothing wrong with that. But I firmly believe, as a medical doctor, as an orthopedic surgeon, that patients need to also be assessed by an MD. Patients need to be assessed by a physician because of the comprehensive history that we take, the comprehensive and thorough physical examinations that we perform, the utilization of advanced cross-sectional medical imaging, including Xrays, MRI, CAT scan, to definitively get to the accurate diagnosis. Because so many times in my career, over the past 25 years, I've seen patients that were being treated by outside chiropractors for so many years, and unfortunately, things were missed. There was a presumption that this patient had this diagnosis or that diagnosis or this diagnosis or that diagnosis. But unfortunately, the patient had an underlying tumor, cancer, whatever it may be, that could have been recognized and treated at an earlier state. And so it was devastating to me over and over again when things like that would happen, or if patients were being treated conservatively when they had a surgical problem that we at the Kayal Orthopaedic Center could have fixed years before and given that patient their life back, their extremity back, their quality of life, their function, many years earlier. So, it's a lot easier for orthopedic surgeons to deal with things when the injuries are acute as opposed to chronic and sometimes irreparable. So it's incumbent upon us to make sure, if you're treating a patient, to make sure that the diagnosis is 100% accurate, that the patient had adequate medical assessment and imaging to make sure nothing gets missed. And once we know that nothing major is going on, by all means, that chiropractor can continue treating that patient to make sure that patient gets better or to help manage that patient's symptoms over the years. But I believe firmly that a thorough medical examination and assessment be first performed to rule out bad things and then continue with the conservative management. So that is something that has become the modus operandi at the Kayal Orthopaedic Center. We've acquired so many chiropractic practices and physical therapy facilities that have joined our practice, but every patient needs to be seen by an orthopedic surgeon, get assessed, make sure that the diagnosis that the chiropractor or the physical therapist is treating that patient for is accurate, and nothing more needs to be done, no more intervention needs to be added or imaging has to be performed, and then we can continue with that conservative management. So that is something that is so important to us, and fortunately our chiropractors and physical therapists that have come on board recognize and understand the importance of that. And actually they feel so much more comfortable knowing that they're not missing anything as well, that they can continue to treat these patients the way they've been treating them for years, and they've been assessed, and everybody's happy. You agree with that philosophy, Mark?
I absolutely do, and it's very well said. And from a provider, I will tell you, the patients appreciate it so much also. When we first started and you came into the practice, the patients were overwhelmed. However, they appreciate it. So many, as you said, unfortunately, they have underlying conditions. It may not be that the chiropractor is focusing on that specific condition, but through the joint operation of the specialists, of the providers, other conditions, as you said, are always picked up. And I'm thoroughly impressed by that because it really benefits the patient. And that's what it comes down to.
It's actually probably the most important take-home message of today's podcast with Dr. Leichter, that we cannot emphasize that enough. We as orthopedic surgeons at the Kayal Orthopaedic Center firmly believe in the specialty of chiropractic. However, there is a disclaimer that every one of these patients needs to be seen by an MD, an orthopedic surgeon, get evaluated, proper imaging if necessary, to rule out other bad things before we continue with that conservative management. And that is the modus operandi of our practice. Let's just digress from this a little bit, Dr. Leichter. And, why don't you just tell us what inspired you to go into the field of chiropractic, and tell us a little bit about your background, your education, and whether or not you were always at the Kayal Orthopaedic Center.
So I will start when I was 10 years old. So when I was 10, my mother was actually on her back and I didn't know what was going on. She pulled her back out. I had no idea when I was 10 years old what was going on. The paramedics came. They said, we could take you to the hospital. There's not much that's going to be done. So I didn't know I had an uncle and a cousin in the field. He came over, and within 2 days, my mother was walking around. And I said, that's what I want to do. At first, I wanted to be a dentist, but then I said, you know what? I want to do that. So from there, I did my education, went to University of Hartford in West Hartford, Connecticut, got 4 years a degree in BS in biology. And then I further went on to Long Island, New York, where I went to New York Chiropractic College, and I got a doctorate of chiropractic degree in 1992. From there, I went to California, and I decided to do an internship in Burbank, California. So I stayed there for about a year. I didn't know how long I was staying, but I stayed there for a year, and I actually missed the East Coast, believe it or not. So I decided to come back and opened a practice in Rockland County, New York, with a partner of mine, and we were there together for about 6 years and went on to private practice for 26 years. And then the last 5 years, we joined. We had a nice conversation about 5 years ago. We both saw what was going on in the field. And as we just spoke about recently, it was a joint operation and it benefited the patients. And when I was after school, I did 100 hours of MRI education. I did 100 hours of scoliosis training. I did some electrodiagnostic training. I further my credits in continuing education credits. So our education as chiropractors are there. Every year we have to do continuing education requirements. And I do have licenses in New Jersey, New York. I had one in California also. And it's been a great operation since we joined. And it's been a family business, even though I'm the only one in it. But the story goes back to when I was 10 years old. It's nice.
That's a nice story. Actually, we've only officially joined forces for a little over 5 years now, but we've been working together almost exclusively for the past 11 years or so, right?
Absolutely. So since you just brought that up, because this is interesting. So 11 years ago, I was looking for an orthopedic, as I said, and I came across orthopedic in Bergen County, where I'm from. And I said, you know what, let me see if we could find a really good orthopedic group or orthopedic surgeon that I could work with. So I sent about 3-4 patients over, and the results were outstanding. Even though the patients had to drive 20-25 minutes from Rockland County to Jersey, the patients were unbelievably happy. accepted the office well. The compassion and passionate of care that was the patient received was amazing. And to further elaborate, I got chiropractic reports back from an orthopedic surgeon, which was just amazing. The loyalty that you and your team have towards chiropractors, as you said, is just outstanding.
Thank you so much. It's an honor to first of all have you here with us, but to hear those words after working with you so well for the last 11 years. So you were our first, to join us, your Stony Point practice, and since then, how many groups have joined us? Chiropractic and physical therapy groups, would you say, Mark?
I would say we probably have close between chiropractic and physical therapy. We probably have over 10 right now, at least. It's growing real nice. It's pretty amazing.
It's been amazing. I think a lot of the chiropractors in the area of northern New Jersey and New York have recognized the benefits, the tremendous benefits to themselves personally, but also to their patients and to them professionally as well, of joining the Kayal Orthopaedic Center. Because when you're working with such a solid team of healthcare providers and a team, each of whom adds their own expertise to the care of that patient, it's a beautiful feeling that we get to experience, a feeling of comfort, knowing that we have the skilled providers in our practice to help our patients get better. Anyone and everything and anything that you need that pertains to the musculoskeletal system is there. If our patients need advanced medical imaging, we have it. With fellowship-trained radiologists, musculoskeletal and neuroradiologists reading our studies. If they need a rheumatologist, we have it. If they need IV infusions for rheumatological medicines or osteoporosis medicines, we have it. If they need physical therapists, chiropractors, acupuncturists, massage therapists, we have it. If they need podiatrists, orthopedic surgeons in every area of orthopedics. So you can feel comfortable taking care of your patient. And if you sense the need to, refer to one of our specialists in-house, that specialist is at your beck and call, available to care for your patient, just a text away, a phone call away, and very often that patient will be seen the same day or the next day, just because of the amazing relationship. So it's fantastic. Nothing gets missed. But what was it for you that inspired you to join us officially?
Well, before I go into that, I just want to elaborate on what you just said. Two specialty fields which go unnoticed, I think, are rheumatology. And the reason why I'm bringing that up is there are so many autoimmune diseases nowadays, and it goes undiagnosed a lot. And as chiropractors, we see the patients first a lot of times. And with these musculoskeletal complaints, they might not be just a chiropractic patient. So when the patient sees the rheumatologist picks up on other conditions, and it might just be an autoimmune condition. It might be something else. But we work hand in hand with these doctors, and the patient responds to both professions in the same way as you said with podiatric also. Podiatric care, doctors who specialize in the foot and ankle and lower extremity, okay, these conditions go unnoticed also. And since we deal with the whole spine as a structure and the body, so I'd like to talk how I joined, and what our team is like. So about 11 years ago, I thought it was very interesting is we were friends and I sent patients over. However, being in private practice for a chiropractor nowadays with the headaches of the insurance companies, the headache of co-pays, the headache of cash patients, okay? Patients get insurance plans, but sometimes chiropractic's not involved in those plans. So there has to be chiropractors need to work arrangements out with the patient and everything. However, they're still not doing the whole, giving the best care for the patient. So we got together, and I thought it would be a great addition for your practice to be up in Rockland County, as well as my practice now being under the roof of Kayal Orthopaedic, which made my life easy because the business aspect, the overhead, everything is covered by Kayal Orthopaedic, and I get to practice as a chiropractor and concentrate on my patients, bringing them into the practice, giving the best quality care, doing best care at the right time for the patient. And it was just a bond, which has been great. And as you said, other chiropractors and physical therapists have seen what we've done, are seeing what the outcomes are of these and now wanting to join and be part of this amazing operation organization, because we offer so much under one roof, and it's for the best care for the patient.
Yeah, it's actually snowballing, isn't it?
Yes, it is. Very exciting.
The more that join, the easier it is for the others to recognize the importance of joining a multi-specialty organization like ours, where we can offer complementary medicine as well as traditional allopathic medicine to our patients. It's a beautiful relationship.
And just to elaborate on the chiropractors, we have amazing chiropractors outside of myself that have joined this practice, that have actually given to the practice now, and we've learned from them actually. So it just keeps growing. The domino effect is happening, and the knowledge that we're gaining from these other chiropractors is just outstanding.
It's a team, that's our motto, one-stop shop for all your orthopedic needs, because, it does take an army of healthcare providers in different specialties to help our patients get better. And we have to just complement one another in the way we care for our patients. And it's just something that works so beautifully. And I think others are recognizing that. So it's a beautiful thing. How has it really benefited your patients, would you say, Mark, as opposed to how it used to be, say, 15, 20 years ago, just operating as a successful, independent chiropractic physician in Stony Point, New York? How has it benefited your patients to have access to any specialty, any specialist in the field of musculoskeletal medicine, orthopedic medicine, rheumatology, podiatry, pain management, at your beck and call, at your fingertips, to be able to provide that level of service to your patients? How has it impacted you personally, professionally, and your patients?
So personally, I could say practicing 31 years and being part of the Kayal Orthopaedic team with last 5 years, and knowing you for the last 10 years, have personally benefited me in numerous ways. I would say one is the quality of care that I can give to a patient now is much higher level. I'm offering them a whole body care and diverse type of treatments for the patient. The patients absolutely love having the being able to access multiple types of care, having orthopedic, rheumatology, podiatry, pain management, everything that you said at our fingertips has helped me tremendously be able to direct that patient for the right type of care at the right time and give the patient the overall health of the patient. And as far as a profession goes, I think the reason why most chiropractors and physical therapists are coming aboard and wanting to join us now is basically what I've seen with my patients. It's a one-stop shop. The patients get quality of care. It's just not, it could be acute care, it could be chronic care. We have pain management, exceptional pain management care. So we have all this diverse type of care that the patient sees, the patient now asks, can I see the specialist? So it's not us having to direct it anymore. We need to treat the patient as a whole, and we have the tools to do it, and you provide those tools to us to be better doctors.
That's fantastic. Well, I hope today's podcast was helpful for you. I hope that you maybe received a better understanding of what the field of chiropractic is all about and how they fit into the equation, working with physical therapists and massage therapists and acupuncturists and physicians at the Kayal Orthopaedic Center as well. It is truly a team approach, and I hope you can recognize how passionate I am about this team approach and having specialists like Dr. Leichter in our practice in the field of chiropractic medicine in our practice as well, and being able to offer those services to our patients. I found that over the past 25 years that patients believe very strongly in the field of chiropractic, and often they're the first provider that these patients will ever see before ever making it into a physician's office like mine at the Kayal Orthopaedic Center. So we're just so honored and privileged to have Dr. Leichter with us. I hope that this podcast was helpful. And if you ever need our services, we're just a phone call or a click away. Thanks so much for being here, Dr. Leichter.
Thank you, Dr. Kayal. It's been a pleasure.
Thank you.